when you look at our healthcare system, and there's so many complications.
I feel really sorry when patients come to me on daily basis and kind of telling me, oh, Dr. Nada, it's really so difficult to find a good GP. There's no good GPs anymore. No one listens.
It is too hard to see a bulk billing doctor in our suburbs and towns and communities right around Australia.
Hefty bills, forced to cough up on average $41 for a standard consult, more than 3% higher than last year.
The rising costs and the demands of the pandemic mean the health system as we know it could be on the verge of collapse.
Standard consults and the amount of time is not enough, which eventually all of this will affect the patient more than anyone else.
With affordability and what the actual healthcare system is, and also for them to have a look at things from the perspective of the GP.
And I see a lot of issues happening with this. Yeah, and a lot of mistakes on daily basis.
Yeah, what are the flaws in our bulk billing rebate system that should be addressed?
We need to understand what bulk billing means and how the system currently works.
What is the solution for our healthcare system? Welcome to this episode of MedCentres TV, where we confront the pressing challenges facing Australia's healthcare system. Staff shortages, burnout, ambulance ramping, and a severe lack of hospital beds have highlighted the vulnerabilities in our system. To shed light on these issues, we are joined by Dr. Nada, a seasoned GP with extensive experience in both hospital settings and primary care across rural and metropolitan Australia. This is MedCentres TV, and I'm your host, Deon Raju, inviting you to join the conversation on the future of Australian healthcare. Welcome, Dr. Nada.
Thank you.
Dr. Nada, how you doing?
Good.
Good. So some clinics still offer bulk billing, while others struggle to offer bulk billing. How are these clinics still able to sustain themselves, the ones that offer bulk billing?
Right. I think they both are struggling, but in different ways. Let's put it this way. We need to understand what bulk billing means and how the system currently works, because that's where a lot of the confusions comes, especially from the patient perspective. And we'll explain why as well that confusion has been, because the change has been recently in the last few years. So for a normal GP day, let's say 8 to 5, for a bulk billing practice to sustain their doors open, because again, GP practices are a private sector. They're not a public sector like the hospital. So in order for them to keep the doors open and sustain their fundings, they need the GP needs to see at least 30 patients a day, right? So that means from 8 to 5, 16 minutes per patient. That if the GP didn't take 1 minute break that day, no lunch break, nothing at all. Now, for those, like for the standard consult, now, do you know how much the GP ends up earning per patient?
Well, I think that's the $1 million question.
Yeah.
We all would like to know.
So I'll let you know, because
Yes.
People kind of think and look at doctors, they think they want more money, they're actually rich. But per patient, for the standard consult, the GP takes $15.
Wow.
Now, if you think about it, is this doable? That's the idea of why bulk billing is not sustainable. Because if you want to see that amount of patient, first, it is so much overwhelming during the day, and it's not always the safe and the right medical practice to do so.
Sorry, are you saying
Yes.
that GPs that bulk bill,
Yes.
they would have to see around 30 patients a day,
Correct.
which would equate to 16-minute consults.
Yeah.
And that's if they didn't take a break at all. And for that consult,
Yeah.
the GP earns $16, or was it $15?
Yeah.
$15.
Yeah. Because The current rebate for the standard consult is $41.
Right.
Now, the $41, the GP is a contractor in a clinic, mostly in a 30% contract deal. So as soon as he accepts the rebate from the patient, 30% plus 10% GST goes to the clinic, plus most GPs pay 40% or more to the tax. So after the tax deduction, after the clinic deduction, you want to take how much actually they take. So they take what's left from the $41 is around $15. Now, you don't like to talk in medicine to make it sound a financial thing or a business thing. It's very uncomfortable as well because it's everyone needs and everyone should qualify for a good quality health without having to put the strain of thinking about the cost to make it as a burden for them to get a good quality healthcare. And it's never like you see the doctor discussing the money issues with the cost of the consult before the patient comes in, because you're there to help. You're not there for anything else. But we're talking about the reality and how a private clinic could keep its door open and keeps on functioning. How they'll pay the staff, the reception staff, their equipment, the dressing, the thing. Again, it's not a public funded practice. It's a private practice, and that's where a lot of patients have confusion. So in order to keep it as a bulk billing, those GPs have to see too many patients and not to put the time, the quality care for the patient. And I see a lot of issues happening with this. And a lot of mistakes on daily basis.
Oh, wow. It's, I think for the man on the street, the average Australian, that looks at the rebate, or like you said, around $41.
Yeah.
I think maybe it's a misconception, if I could say that $41 is pocketed by the GP. Mm-hmm. But if it's contractual, like in a 70-30 split, if you're saying that after tax, the GP then earns $15.
Yeah.
And if you're saying that the 30%, which is an average of $12 per consult, goes to the practice, then how is it sustainable? And I think this is the narrative, or this is the reality that looking at it from the other perspective, that we see the reason for bulk billing practices and probably more and more practices moving away from bulk billing to mixed billing, because I suppose the sustainability and the viability on the pure numbers.
Which is again sad to watch, but the other thing for those bulk billing practices to continue, they need as well a number of GPs to be able to do that, at least 4 to 6 GPs who are bulk billing to be able to get enough funding for them to keep this private clinic surviving and the doors open. But where can you find that number of GPs, especially in rural and remote areas? So that's where the strain is coming, especially with the increased cost of living, with everything else. But the funding and the amount of rebate for GPs had only, like, if it increased every few years, it increased by cents, which is not coping with what's happening.
So, Dr. Nada, this is, I think, the crux of the misinterpretation or probably lack of knowledge of the man on the street or every Australian that thinks that bulk billing is sustainable and it's our God-given right to have access to free primary health. Yeah. I'm fascinated at the sustainability, because if you need 6 GPs to kind of break even, that means you need 180 patients a day for 6 GPs, all earning, in a bulk billing scenario, $15 per patient, whereas the practice takes on $12 off that. Practice then has to sustain the ongoing operations of the practice, But that $12 then also is pre-tax.
Well, think about, like, now talking about this again, like, because we're talking about a materialistic stuff and about money, which is not a comfortable subject to talk about. But again, we're not mentioning this just for the doctor's benefits and part. We're mentioning this as the system that will help give a good quality care for the patient, because that's what we're risking. We're risking those kind of rushing services, overlooking a lot of serious diagnosis and disease to be able to sustain the bulk billing. But as a result, the patient is getting a poorer health care. And as I said, a lot of mistakes are happening. Now, I feel really sorry when patients come to me on a daily basis and kind of telling me, oh, Dr. Nada, it's really so difficult to find a good GP. There's no good GPs anymore. No one listens, or they don't know, or things like that. It's not that they don't know. They just don't have the time to put, so they misdiagnose. That's the saddest part. Most of the mistakes happen not because of a lot of other doctors they don't know. They all spend years of study and stuff, and I assume that a lot of them are, they have the good knowledge, but they did not have the time to dig into the real root cause of the problem, rather than just looking at the superficial thing. And you go, all right, yeah, well, it's probably your back pain instead of like a malignancy, that kind of a tumor. It's because of a musculoskeletal. There you go, and have some Nurofen or stuff. Next patient, come in. Now, so you feel really sorry and sad for the poor quality of care that patients are getting with these services. But at the same time, because I'm a doctor as well, and I see my colleagues and I kind of witness what's happening behind the scene, which the patients don't see. And I see a lot of GPs, good ones, who are overworking, tired, burnt out, and don't even have a decent lifestyle and don't have a decent income. I feel sorry for them too.
Okay, so let's come back to that. That's a very important point, but we want to come back to that. Is it accurate to say that GPs are opting for mixed and private billing practices just to earn a higher income?
Well, to be honest, I won't get shy of saying that they, like anyone else, deserve a higher income, especially after all the years of education and what the money they have to spend still on themselves for college, indemnity insurance, and all the cost that is involved. So they do need to survive like any other civilian in any other profession. But the issue is, why does the GP have to pay the price of that from himself rather than having a better system in place that rebate the patient more money? Because again, the GP practice is a private sector, and in Australia it's only GPs that are still sailing in the boat of bulk billing and no one else. So the average take home of many allied health, including chiropractors, physiotherapists, dietitian, of course, naturopaths, and all of these, with no surprise, surpass that of a GP, because only, as I said, GPs are the only one who are bulk billing. And there's no comparison between their income and the other specialists' income. But I believe the reason for this is there's many reasons why this kind of happened here for a long time. So Australia for a long time was recruiting international doctors to cover the GP shortage. With all the respect, most of these international doctors are amazing, and the good thing that most of them they're not postgraduate year 1 or 2 with a minimal experience. Some of them, they were surgeons, physicians, whatever, for many years, and then they came with all this experience before they started GP career here. So we know that GPs in Australia, the GP system is actually good because you can deliver kids. You can do remove the appendix, the gallbladder, and do a lot of surgical skin. So you can do a lot of things that you can offer, especially in rural areas. That it's very much dependent on the GPs. A lot of these GPs as well were really, really hardworking, but they were bulk billing, and then they were actually, by the increased cost of living, they were then forced to increase the number of patients. I know some GPs see 80 or 100 patients a day.
Right. So that brings me, if we go back to our previous, not question, but the idea of our GP shortage. Because if you look at the bulk billing model, and based on the numbers that you've just given me, that a doctor's going to earn around $15 per patient. And if a doctor's going to earn around $15 per patient, and if the practice is going to take $12 per patient, and we don't have adequate doctor numbers in terms of the amount of doctors to, I suppose, suffice that model of 6 doctors in a bulk billing practice, then we've got a doctor shortage, and we've got doctors working harder in a bulk billing system, running at a loss, to then actually fund the healthcare of our community. And so it's not the government then that is funding it, it's doctors putting their own time, running at a loss to fund our healthcare. And therein lies, I suppose, the negative connotation for doctors to want to get into GP land, so to speak.
100%. So that's what's happening. So medical students and your junior doctors, they come and they witness for themselves. You don't need to tell them anything. They just, we try to kind of, you say things how they are and the truth, and you try to encourage the students, but eventually you can't give them a false hopes and stuff. You need to kind of give them the picture as it is. They come and witness things as they are. So they have experience with many good doctors where they're really, really hardworking, rushing patients, a lot of patients waiting in the waiting room, walk-ins, emergency cases. You never know what's walking next to your door. So your medical knowledge really needs to be very good to see the kids, the elderly, the complex cases, the simple cases, mental health, empathize. Lot of things happen every day. So you need really a good medical knowledge. You need a lot of skills. You need a lot of hard work. And then they see the doctors running, multitasking, staying every day for after hours, for many hours.
Not a great lifestyle,
unpaid,
is it?
Unpaid, to do a pile of paperwork after they've seen all these patients, because they don't want to pay a patient to wait. Because again, that 16 minutes or 15-minute consult or all of that, it covers what you want to kind of see the patient and document and do everything. But then when those medical students see this, and then at the same time is a human nature, and after how much effort they spend on themselves and on their studies and the cost of medical school and afterwards, they see the senior GPs not even driving a decent car or having a decent home. Then they go like, oh, do I want this to myself? The other side, they sometimes experience, they have an experience with some GPs, which I don't know how to say it in a nice, nice way, but maybe with the time and that the same system, how it's going, they became a little bit careless. So they are just kind of seeing patients in and out, or write a script, anything more complex, a referral.
So it becomes fast food medicine, speed medicine.
Exactly, but they lose the value of real medicine. And you can't do that type of medicine in rural areas for sure, because there's no way you can kind of refer everyone and do everything. But that puts off the medical students and things away, especially that now we have many medical schools in Australia and Australian graduates that are asking for a work-life balance, asking to have a better income, asking to have a decent lifestyle, and kind of at the same time kind of being able to concentrate, put their effort during the day to concentrate and give all of their care to the patient, rather than caring and rushing of how many patients I can get in to be able to survive.
So I guess, as a GP working in our healthcare system, any GP wants to feel valued, right? One, and I think owing to that is for any consultant, any patient, you're liable for the management and the care that you give that patient. And the decisions that you make, could be catastrophic or real beneficial to the patient. Having said that, Dr. Nada, if we could speak more about your practice, what's the average consult time that you would like to spend with your patients that you think is adequate or decent?
First, you can't compare two patients together. You can't put like a certain time and apply on all patients. It doesn't like in reality work like this. Second, especially when you meet a patient for the first time, you'll need some time with a patient. 16 minutes or 15 minutes or less than 20 minutes, whatever they want to call that standard consult, is no way and enough time to know the patient. And the issue is that in medicine, there is something called a holistic approach. You never can diagnose and treat someone if you do not assess them as a whole and know them well. You could miss too many serious stuff. So in a holistic approach, you need to know all the medical background for the patient, all the previous surgeries, all the family history, social history, screenings up to date or not, the mental health status, all of these things, what symptoms they came with, for how long did it, all of this to assess it, it needs time. And then depending on one patient and another and how old they are and how complex, it could take an hour sometimes. But you don't want to compromise a good quality care and for a poor care just to kind of say it's what's kind of we can do to make it all about,
So
the money we can build.
your consults could range from
40 minutes to an hour.
40 minutes to an hour.
Yeah, easy. Wow. Of course, you can do the short ones and walk-ins, and some people comes for an easy, a quick kind of a simple task. If you know them, especially from before, or you assess them and then they're coming their follow-up. But in order to actually investigate and assess the patient and whatnot, you will need this time for one person, sure.
You're a thorough GP.
Well,
40 minutes to 60 minutes.
That's
wow.
what it should be like.
Right.
Yeah.
So then, who do you bulk bill and who do you actually charge?
So I would definitely keep all the demographics and the things of the patients there. So as I said, the GP is paying the price of this. So if I see a patient that is struggling or have a low income, or they tell me a situation, of course, I kind of would go, well, I'm here kind of to help you more than for anything else. But and then the practice that I'm working in, then they come in like, what are you doing now? This is, we can't survive on your charity basis, which I would love to continue as my profession as a charity basis. And I do a lot of medical missions. But in the real world, like if there is no income coming, that's this. But I do assist in anyone who needs and anyone who's this. I basically just have to bulk bill them. But that's come to that, from the price of the GP rather than anything else.
So I know in most mixed billing practices, they bulk bill children under the age of 16 and concession and healthcare card holders. So with those two big divides, what happens then to that group of people, young families, one income per household that don't qualify for bulk billing? What happens to that group?
So again, you need to understand the system. So those the practices that bulk bill, basically they now bulk billing or they mix bill. They bulk bill the elderly or kids under 16 because they have a small incentive. That was $6 2 years ago during COVID, and then that tripled. So now it's $20. $20 in total before the clinic deduction and the tax deduction again. But again, as you said, it doesn't mean that if someone is not a pensioner, and not every elderly, that incentive is put for pensioners or kids under 16. But as you said, there's a lot of people who are unemployed or struggling, or they can't afford a lot of things. So it's usually a doctor's self-assessment, and kind of out of them they say, all right, I will bulk bill you, because the patient needs to understand that the bulk billing rebate is not for the doctor, it's put by the government for the patient. But what the GP or the doctor says, then yes, I will accept this rebate. and then divided between the clinic and whatever kind of obligation that they have. But it's only the GPs that are left bulk billing in this day and age within the private sector.
Well, I see that group of people, the young families, maybe with one income for the household, those are predominantly the group of people that are going to be disadvantaged and struggle. Bringing me to the next point is that could the elimination of bulk billing lead to increased healthcare costs down the line as patients delay seeking treatment, initially because of the costs or the ongoing costs for healthcare?
That's what we worry about. That will be so sad to see that, and we don't want that to happen here in Australia. I think I always kind of positive that things should get better with a better communication between GP advocates and the politicians in the healthcare system. But the problem is there's a lot of pushback. And then there's a lot of other solutions in place that doesn't fix the problem. Rather kind of find maybe other alternatives. For example, they kind of increase the number of pharmacist prescribers or the nurse prescriber and or even kind of putting more incentives to the standard short consults rather than fixing the issue with the amount of rebate and putting more time in quality care for the patient. Because see Deon, like now, if patients kind of, and I don't blame them for not kind of understanding how the system works, but someone needs to explain those things along the way. So they come in and book the standard consult, right? So it's 15 minutes. They come in to see a GP. Imagine they see you for the first time. So first time in 15 minutes, you want to still assess them before you then start treating the problem. How much can you do? Some of the patients, they come in with I have a list of problems for you today, right?
Yeah. That would be me.
For that first time visit and for booking only a 15 minutes consult.
So, Dr. Nada, in a typical bulk billing consult, where you speak about, people are talking about 6-minute medicine, and you talk about a 16-minute consult. Can you give me an example of a typical bulk billing consult that?
I can give you a lot of examples.
Yes,
Let me give you some scenarios.
That's fraught with danger.
Yeah. We'll give some. So, for example, patients will book for a standard consult, less than 15 minutes. They present first time, let's say, to see this doctor. Imagine in good medicine how much in that 15 minutes for a person that you meet for the first time could actually assess before you diagnose and treat the problem that they came with. Because as we said, in a holistic approach, you'll need to understand the patient as a whole to pick serious stuff. Some of the patients, they come in to the doctor with they say, I have a list of issues for you today. And they have actually a list of issues, expecting this poor GP to solve the issues that have been happening and all the life aspects and issues that have been happening for years in this 15 minutes. Now, on the other hand, those patients, some of them are faced with those rushed GPs and bulk billing kind of a pace with in and out kind of a patients, and they go with this attitude. I have you only can pick one problem on a consult on a day. That's it. Now, of course, this is because of all of the system issues that we talked about. In order for them to see 30 patients a day, that's the only way they could cope. But is this a safe medicine? The answer is simply no. For a patient, if they're non-medical, they won't know what symptom is actually a critical and what symptom is not. For a patient, something that would cause them a pain, or because a musculoskeletal pain or a skin condition that is apparent is more important than some mild vague symptom that for us could be the key for diagnosing malignancy or a sinister or serious disease. That both needs time to diagnose and effort and needs to listen to the patient to the other issues. And hence, there is a lot of mistakes happen, which is unfair for the patient, and then a lot of kind of reputation for a lot of GPs are taken away because of those mistakes, because again, it's not most likely because they don't know, just because they didn't put the time to actually dig and put the time to actually assess the patient correctly. So it is, yes, set to watch those things happening on a daily basis.
I think there's the problem of communication. And as a community, doctors are there to help the community and play an integral part, in our healthcare. I guess without doctors, we would be in grave danger as human beings, full stop. But I think when you look at our healthcare system, and there's so many complications, there's all sorts of issues that we are trying to address today, and I guess also educate today, both on the other flip side of our community, with affordability and what the actual healthcare system is, and also for them to have a look at things from the perspective of the GP. Because I also think that for a long time, I suppose GPs have been taken out of this equation because they are the ones that are providing the service, and they are the ones that are fraught with danger. God forbid that they make a wrong diagnosis.
Because they've been used to being used and abused.
Well,
and then if a problem happens, and that's it.
I wouldn't go there.
We won't want to go there.
I don't want to go there. But look, do you think that the elimination of bulk billing, it's going to cause increased costs in our healthcare system down the line as patients decide not to go and see GPs because mixed billing or private billing is a deterrent, causing, a risk of healthcare to themselves down the line?
Well, that is basically that will be very, very, it's happening, and it's very sad to watch. And it will be sad to see this problem is going to deteriorate before actually fixing it, because I believe fixing it is we're able to fix it together, and things could get better, but we need to work together for this, because lot of GPs have decided to give good quality care and time for the patient, and that's why they hence went to the mixed billing rather than bulk billing and rushing. But most of the doctors that I know, they're still, as I said, they are doctors in their heart, and that part of this is being, put your humanity first and help whomever is on need. But they're doing it on their own price and their own time, rather than what they're getting as funding and rebate. But how sustainable is that is the question. The current solutions do not match what's needed because there's no communication between the GPs in the system and the politicians in the healthcare system that are putting, alternative solutions that does not meet the needs to fix the current issues. So we don't want to see there's some solutions now in place that is actually pushing the GP practice away and away. And the fear is that it's not only that system will break down and then you lose the GP system in Australia, which is a lot of developing countries have no GP system in place. But the result of that will end up in a poorer quality of care to the patients, because see, Deon, the GPs are the cornerstone and the first doctor for you to go to when you need when you have a medical problem, and everyone needs a regular doctor to go to, a regular doctor who knows them knows all their aspect of their old medical issues, advocates for them, and keep everything in a closed loop, and keeping that continuity of care, rather than just, seeing you once for one issue and not dealing with another issue and all of this. So we have something good, we want to keep it and grow it and improve it, rather than lose it and put the patients and the community at a poorer health in the future.
The next point is I'd say it's kind of at the heart of this flaw, I suppose, in my opinion, in our healthcare system, predominantly in GP land. What is the flaw with our bulk bill rebate system that contributes towards its instability? I've heard in the past I've heard comments from Nicole Higgins from the college, and I've also heard comments from Danielle McMullen, the vice president that was part of the task force set up to investigate our system. And I've heard their comments, but I'd like to hear your comments as to, what are the flaws in our bulk billing rebate system that should be addressed, and if it's addressed, how should it be addressed? I.e., for example, consults, time, and the basis of how bulk billing actually works. And if it's addressed, and yes, funding is put in the right areas, it would go a long way to the sustainability of bulk billing.
I'll say it as it is. It's not enough. The amount of current rebate for the standard consults and the amount of time is not enough. So there's no way, if we don't address those issues, that we can fix the problem. So we need a better funding, for sure, to be able to sustain the practice and the bulk billing, and that needs to be worked by the government rather than by the GP himself. And it's set to watch that GPs are accommodating by decreasing the quality of care and increasing the number of patients rather than fixing the root cause, which eventually all of this will affect the patient more than anyone else.
So I guess what I'm saying then is, in the current bulk billing environment, or with the current bulk billing rebate system, what does it encourage in terms of the actual rebates, in terms of short consults, long consults? My understanding is that the current rebate system encourages GPs to do more shorter consults than the longer consults, where the actual funding needs to be aimed at the longer consults so that enough time is given to the GP to make a decent diagnosis. Am I right in saying that?
Yeah, that's correct. Because once you increase the amount of time, the amount of rebate increase does not exactly. It does increase, but it doesn't kind of increase with the time, if that makes sense. So for you to see more patients during an hour is definitely way more efficient to sustain the practice than you spending 1 hour with each patient.
Yeah, because I know patients often feel rushed in a bulk billing consult because of time, and the doctor then has to afford that time to the next patient, and so on and so on. So, having said that, what would be the ideal regarding the medicals, regarding the bulk billing system and the whole rebate system?
Ideally, it would be a system where you can offer the time as per patient's need. So some patients need a complex, very long consult, and in some, you can still be able to do some short consults for whatever is needed. And then you can bill according to your time and your effort that is put into that consult, without putting a lot of strain on the patient to think about, all right, can I afford a longer consult? Can I afford seeing a doctor and kind of have a quality care? So the idea is to have a long comprehensive consult, know the patient, then continue the care from there on, and to be able to have a decent rebate for the amount of effort, time, knowledge, everything that you put to those patients, to be able to continue providing the same service.
Dr. Nada, recently billions of dollars have been allocated to bulk billing, specifically in Medicare. And that still seems to not be enough. What is the solution for our healthcare system?
Well, see, unfortunately, Deon, when we talk about that big number for the whole country, but as well, a small portion of this is going to general and primary care practice. And we kind of, in the system, the doctors working in the public hospitals they are having a more of a decent income, but the GP practice is still a private practice. And it's the only private practice, including specialist, including allied health, including whatever, is the only one that is still bulk billing. So the solution is by encouraging doctors to have a good, because that's what you need. The continuity of care needs a long consult, a good consult, a time for the patient, but then increase the rebate amount to the patient for the private GP practices to sustain and afford the clinic.
Okay, so in short, what you're saying, and also the understanding of bulk billing, my understanding is that the actual rebate is a rebate that is allocated to the actual patient by the government. That belongs to the patient. And as soon as the doctor accepts that rebate, or however much it is, that's then deemed bulk billing. So what we're saying is that rebate that's allocated to patients that currently exists, the rebate for longer consults, which we're saying the government has promoted rebates more and encouraged more shorter consults, the rebates allocated for the longer consults, the government should invest more in those rebates. That then encourages doctors to do the longer consults.
To do a better quality of care to the patients. And again, for the doctors not to be kind of, for the GP practice to move, if it's want to go bulk billing, then it needs either to move to a public sector with more funding, and the doctors do not have to strain and talk about money and those kind of a thing, which shouldn't be in a wall between the doctor and a patient at all. Or otherwise it's a privatized, which we don't ideally want to see that happening as well. So again, there should be a better communication between the people making the decision and what's actually happening in the ground to understand the system correctly and what both patients and doctors are struggling with before trying to put solutions that might cost money but not fix the problem.
So that means addressing the rebate is one way, for longer consults is one way of addressing the system, but the government should be looking at the entire system in its whole, in terms of not just general practice, but also the emergency care system, and addressing that from a budget perspective and from a skills perspective. So that, and only when we address those issues are we going to be able to start to address our healthcare
Correct,
system.
because you need to understand what each sector is there to do and what they can offer, and to make the most out of it. Because ideally you want the GP practice to save the government a lot of money by decreasing, first by preventing diseases from happening, and you want to keep patients healthy rather than getting a disease, or catching the problem early and treating it. So decrease the presentation to emergency department, decrease the admission and readmission to the hospitals, decrease a lot of specialist interventions, and do all of this to be able to do this. You need to concentrate on this group of practice, plus concentrate on the other group, but for each of what they're going to provide and what is the best thing we can do for them to provide that quality of care.
Excellent. Dr. Nada, thank you very much for your time. Just reinforcing once again that our GPs are the cornerstone of our healthcare system. And also thank you for your insight as to bulk billing, private billing, and what it actually is from a GP's perspective every day in terms of running a practice and also being able to afford that service for our public at large. Thank you very much.
I want to just say one thing. I would like to kind of say for the hardworking GPs, please continue what you're doing. Please don't let the money stop between you and your perfect knowledge and hard work and all these years. Still put the time for the patients, listen to them. It's not worth missing anything and doing a mistake and then doubting yourself. You can do it. You can survive. Things can only get better with better communication. do ask for your rights. It's okay to talk about things as long as you're not doing something wrong. And for the patients, please do not let any money issues stop you from seeking any medical attention. Doctors will help you as much as they can. They will advocate for you and help you. So don't put this as a burden from seeing a doctor at all. And hopefully with working together, we can only make things get only better.
Thank you for joining us today, Dr. Nada.
Thank you.
And you, our viewers, we've discussed the challenges facing doctors, patients, and policymakers, from the sustainability of bulk billing to broader healthcare funding issues. Moving forward requires comprehensive solutions, reevaluating funding models, understanding economic pressures and providers, and ensuring equitable access to quality care for all Australians. Dr. Nada's insights have been invaluable. Join us next time. Stay informed, stay engaged, and thank you for watching MedCentres TV.